Hi, my name is Dr. Kerry, and I want to introduce to you a brand new class called Total Body Screening Evaluation. My background as a practitioner comes from over 30 years of clinical experience as an athletic therapist, a physical therapist, a doctor of oriental medicine, an osteopath trained in both Canada and also in England. And also BodyTalk. I've been with BodyTalk since 2000. I'm an advanced and senior BodyTalk practitioner as well as an instructor. Energy medicine is very subtle work. Often it's very difficult to tell what exactly is changing or shifting during a session. The ability to evaluate the body pre and post treatment allows you, the practitioner, and the patient the ability to see the amazing changes that occur as a result of an energy balancing session. It's important to remember that evaluation is not intended to diagnose. Evaluation gives you a starting point to measure change. When this change takes place, it kind of validates your treatment outcomes. No one needs to tell you that you're performing your technique correctly. Both you and your patient can see it in real time. Once your results are validated, the evaluation basically helps you as the practitioner. You develop confidence and credibility. Also, evaluation helps the patient. It helps the patient understand their progress with each session. And when they see their progress, they get excited. When they get excited, they tell somebody. When they tell somebody, this is how your practice builds. This is why I feel evaluation is so important. And this is why I wanted to develop an easy way for both the patient and the practitioner to measure these subtle changes that are occurring during an energy balancing session. I wanted to develop a comprehensive evaluation that was both quick, easy to be used, as well as to be done in as little as 5 minutes. I call this evaluation the Total Body Screening Evaluation, and it consists of 3 phases. Phase 1 is a postural scan. You have the patient stand up in front of you, you evaluate their occiput and their sacrum, and this represents the autonomic nervous system, specifically the parasympathetic system. We evaluate from thoracic 1 all the way down to lumbar 2 with our thumbs on either side. This is the sympathetic system. So we're evaluating for asymmetry of posture. We also check the shoulder levels and the pelvic levels. This tells us about fascial imbalances coming in from the legs as well as the arms. Phase 2 is looking at these lines of fascial tension. We're going to pick up the legs, we're going to evaluate the motion of the legs. This allows us to evaluate lines of tension coming up from the legs into the trunk. We'll look at the arms in the same way. We'll also look at the head and neck. So the head and neck, the arms and the legs all pulling into the trunk. Phase 3 is evaluating transverse diaphragms, your pelvic floor, your respiratory diaphragm, your thoracic inlet. These transverse diaphragms are horizontal in nature, and when they're restricted, they affect the vertical flow of all our vital structures like nerves, arteries, veins, lymphatics, and energy. Now, the reason why I chose to measure these key things, the autonomic nervous system, lines of fascial tension, and the transverse diaphragm, is because the ANS is so important. It controls what we call vasomotion. If you look at the anatomy of a blood vessel, there's endothelial cells, that's the lining, there's smooth muscle, then there's connective tissue. Smooth muscle is under the control of the autonomic nervous system. So when you're in fight or flight, what happens is blood gets diverted to your muscles for fight or flight, and it decreases to your organs of digestion. How does it do this? It's called vasomotion. So it vasoconstricts in the area that it decreases blood flow. It vasodilates in the area that it wants blood flow. So this is called microcirculation. So if you're somebody who has a lot of fear, anger, there's lots of tension, stress in your life, you can have vasoconstriction, so your ability to heal is very low. Because this microcirculation is what helps us heal at the cellular level. Okay? The other thing that we want to look at is the lines of fascial tension, the transverse diaphragm, because if these things are found restricted, it affects the vertical flow of all those vital structures we talked about, nerves, arteries, veins, lymphatics, as well as energy flow. I call these the supply lines, right? Organs, endocrines, body parts need these supply lines. And when they get these supply lines, it helps to promote healing at the cellular level. So this total body screening evaluation class is typically taught as a one-day live class. But now we're offering it online, 2 4-hour segments. Now, due to the demand of distance sessions, I'm also going to teach you how you can do these evaluations remotely. For more information on this class, please contact the person that sent you this video. You can go to bodytalksystems.com or system.com, and you can also email me at kerryjdam@gmail.com. So Kerry, J as in Joseph, DAM @gmail.com. Hope to see you at a class.